Good morning. This is Rick Mason with the Pennsylvania OSHA Consultation Program. I'm a safety and health consultant talking to you today about the new OSHA COVID-19 National Emphasis Program and how it might affect your business. If you have any questions today, the chat's open to submit questions. We'll be answering questions through the chat feature. If we can't get back to you right during the webinar, we'll get back to you within 7 days with a written response. We're presented on the webinar page. My direct email is rmason@iup.edu, and at the end of the presentation, I'll share that again and my direct phone number. Okay, our objectives today, in understanding the President Biden's executive order on protecting worker health and safety, gain an understanding of OSHA's National Emphasis Program, and gain an understanding of recent OSHA guidance on protecting workers, guidance on mitigating and preventing the spread of COVID, because that's the standard, or that's the guidance that OSHA will be relying on if they come in and take a look at your facility from the standpoint of their National Emphasis Program. Okay. So on January 21, President Biden issued an executive order on protecting worker health and safety. It required certain things of OSHA. It required that OSHA revise its guidance on workplace COVID-19 safety, bring it up to date. And it did that 8 days later on January 29. We're going to talk a lot about that guidance this morning. Consider whether any COVID-19 emergency temporary standards are necessary, and if necessary, issued by March 15th. OSHA has not shared a lot of information about this, but it's clear they're working on a standard. They've drafted a standard. They've said that they weren't going to be held by the March 15th date because they wanted to be very thorough and deliberate in their rulemaking. They didn't want to rush it. So stay tuned. That standard may be coming any day. We'll talk a little more about that when we get to the guidance. They asked OSHA to review their enforcement efforts and identify changes that can better protect workers. And there's a memo on March 12th. All of these publications are in the reference section with a link to the OSHA website if you want to take a closer look at any of these. And finally, they asked OSHA to launch a program to focus their enforcement efforts on violations that put the largest number of workers at risk or are contrary to anti-retaliation principles. And you'll see that both worker risk and anti-retaliation is a theme throughout the rulemaking. So this National Emphasis Program was issued the same day as the enforcement memo on March 12th. And the first thing we'll go through is the requirements, who's going to be targeted and how for the National Emphasis Program. And finally, President Biden directed that OSHA do a coordinated outreach campaign to inform workers and the representatives of their rights, with a special emphasis on communities hit hardest by the pandemic. Again, emphasis on employee rights. Okay, the National Emphasis Program, its stated purpose is to ensure employees in high hazard industries are protected. Targets establishment that have workers with either increased potential or that puts the largest number of workers to serious risk. And also the National Emphasis Program ensures workers are protected from retaliation. There's an expiration date. The directive is effective for no more than 12 months unless canceled or extended. Background statement is this enhances OSHA's emphasis on COVID-19 related hazards by one, formalizing components for a planned and program follow-up inspections in workplaces where there's high frequency of close contract, where the hazard's prevalent, and reaffirms OSHA's adherence to long-standing inspection policy that relies predominantly on on-site in-person inspections. The goal, significantly reduce or eliminate worker exposure to COVID-19. Targets those industries and workplaces where employers have high frequency of close contact. Accomplished by a combination of inspection targeting, outreach to employers, and compliance assistance. And OSHA is directed to perform a high percentage of COVID-19 inspections, focusing the agency resources on COVID-19. And those industries where COVID-19 has shown to be occur at high incidence rates. Okay, so who's covered and are you covered? There's a master list of establishments. It's pretty all encompassing, as we'll see. There are two master lists for site selection. So A is all establishments identified as having a North American Industrial Classification System code listed in appendixes A and B, and especially those establishments in appendixes A and B that also have an elevated incident rate as indicated on their Form 300. It's generated relying predominantly on Appendix A. So there's a system for generating random visits, and it's going to rely primarily on Appendix A. Also, we'll see, we'll talk about this a little more. The area offices have a lot of flexibility in this. They may add establishments based on information from appropriate sources. So if they're getting complaints, they can add your facility. And as we'll see, they're also going to have the ability to take your facility off the list in certain cases. So who's covered? Appendix A is broken into two groups: healthcare industries and non-healthcare industries. So covered in healthcare industries: doctors' offices, dentist offices, home healthcare services, ambulance services, hospitals, psychiatric and substance abuse hospitals, specialty hospitals, nursing care facilities, residential facilities, and other continuing care communities, and assisted living for the elderly. So pretty wide coverage in the healthcare area. And as we know from the news, those are areas that have been hit pretty hard. We have a lot of persons in close contact that have been pretty hard with the high incidence of COVID. For non-healthcare industries, meat processed from carcasses, again, they've been in the news, animal slaughtering, poultry processing, supermarkets, other grocery stores, discount department stores, general warehousing and storage. They're targeting temporary help services. You see the asterisks. They're finding fairly high incidence of temp workers in these other industries. So that they're not going to temporary worker establishments, but there'd be a focus on temporary workers in other establishments, in these other establishments. Okay. Full service restaurants, limited service restaurants, and correctional institutions. Again, seen outbreaks in correctional institutions in the news. Okay, this is Appendix B. Remember, they're relying most heavily on Appendix A, but they also include industries, picking up some industries in Appendix B. And as I said earlier, it's pretty all-encompassing. All of the agricultural, forestry, fishing, hunting codes are covered. All of the construction of buildings codes are covered. Note the asterisks there. All the heavy and civil engineering construction covered. Specialty trades covered, all with an asterisk. Food manufacturing, beverage manufacturing, wood product and paper manufacturing, asphalt roofing, saturated material manufacturing, petroleum and coal products, chemical manufacturing, plastics and rubber manufacturing, non-metallic minerals, primary metals, fabricated metals, industrial machinery manufacturing. So, the majority of manufacturing codes and construction codes are covered in the secondary appendix. Appendix B goes on: computer and electronic manufacturing, electric equipment, transportation equipment, wood manufacturing, kitchen cabinets, other miscellaneous manufacturing, nurseries, garden centers, farm supply, additional food and beverage stores, general merchandise stores, including warehouse clubs and centers, urban transit, interurban and rural transit, school buses, special needs transportation, the postal service, industrial design services, other electronics and precision equipment, commercial industrial machinery, electric repair and maintenance. So it catches most of us. For certain industries, those were the asterisks I mentioned: construction, ship repairing is in there, the postal service. The area directors again have broad authorities. If in their area they're seeing high incidence rates in these businesses, these types of industries, they're to remain on the list. But if they're not seeing high incidence rates, they can remove these industries from their list. So a lot of flexibility given to the area offices here. And discretion also to delete establishments that have basically had a COVID inspection already. If they've issued a citation, it's been dealt with, no serious citations, and follow-up inspection showed that there were serious citations, and follow-up inspection showed they were addressed. So it basically, if OSHA's been there, they don't have to come back. Okay, so inspection procedures. Under a national emphasis program, we get them all the time. Right now, we're in year two or three of a national emphasis program on amputations, industries that have had a high incident rate of amputations. So normally there's 90 days of outreach when OSHA announces a national emphasis program. In this case, they're saying that OSHA has continually conducted outreach, and so this one became effective immediately on March 12th. They said targeted inspections should begin within 2 weeks of the issue date, which have already passed. So it's a little different from a routine national emphasis program in that state. Again, a lot of emphasis on protecting workers who have concerns. So they mentioned that there are existing worker whistleblower protections that may exist for workers who request inspections, workers who complain about the COVID exposure, workers reporting injuries or illnesses may be covered under one or more of the whistleblower protection statutes. There's a requirement that workers are informed of their protection from retaliation and the referral. Also, normally, when an employer makes a whistleblower complaint to their area OSHA office, the area OSHA office has some discretion on that. In the case of a COVID complaint, they must refer the complaint to the regional whistleblower protection program. So this had a lot of emphasis on not retaliating against workers who have valid COVID concerns. National emphasis program, if you're working with us, if you're doing a Pennsylvania OSHA consultation, if you have an on-site visit that's in progress, you may be exempt from the program inspection. Obviously, if we come in at this time, we're going to be looking at your COVID-19 response. Or if you are in the OSHA's voluntary protection program or the safety and health achievement recognition program, which is a program that the OSHA consultation program administers that gives special recognition to small businesses with exemplary safety programs. And if you have more questions about our SHARP program, we have more than 50 SHARP companies in the state of Pennsylvania. If you have more questions about SHARP, just refer to our program, and all the contact information will appear at the end of this presentation. Okay, so that's who's targeted by the National Emphasis Program. So what's OSHA looking at? OSHA has said that since they have not issued an emergency temporary standard yet, in the meantime, rely on the updated enforcement, they should rely on the guidance, the January 29th guidance that's come out. So next thing we're going to do is talk about exactly what's in the guidance. A lot of what's in that guidance will probably be in the standard. The standard is kind of a moving target. OSHA said that they weren't going to meet March 12th. Now they say that just last week, new Labor Secretary Marty Walsh put this, apparently had the standard on his desk, put the standard on hold, and asked the CDC, OSHA and the CDC, to make sure that that they're relying on the most recent information regarding the state of vaccinations and the variants of the coronavirus. So so the delay isn't based on the content of the standard, just whether or not the content of the standard is consistent with our ever-evolving knowledge of the coronavirus. So right now we're on hold, could come out tomorrow. He asked that this is a very rapid update based on the CDC's controls. And also, there are critics of the standard that are mostly saying that because of the number of vaccinated workers, that regulation is no longer necessary. And as time goes on, I think that our argument will only grow. So where the standard is going and what it's going to look like remains to be seen. 4 states have issued state emergency temporary standards. The most recent was Virginia in January, and probably the most comprehensive. There's a lot of talk that the new standard may look a lot like the Virginia standard. And so I put a reference, I put a link to the Virginia standard in the references in case anyone wants to look at that. One of the things the Virginia standard does is it does risk assessments, and then it's pretty prescriptive for first workers that are in high risk or very high risk in the healthcare industry about ventilation, about PPE, and about other controls, especially ventilation requirements. And then it's got a different set of requirements for non-healthcare workers. And there's been some hint from OSHA that they may issue both a healthcare emergency standard and a non-healthcare emergency standard. So we'll see what comes. So I guess that's about all we know right now about the temporary standard. Let's look at what we have available to us right now, which is the recent guidance. Okay, so the guidance says employers should implement COVID-19 prevention programs. So they're looking for a written established program. They tell you that they'll continue to update the guidance because of changes in the science, best practices, and standards as we learn more about the virus. This guidance is not a standard or regulation, and it creates no legal obligations. It's OSHA guidance. It hasn't gone through the standard review process. But they say loud and clear that pursuant to OSHA's General Duty Clause, Section 5A1 of the Occupational Safety and Health Act, it requires employers to provide their workers with a workplace free from recognized hazards that are causing or likely to cause death or physical harm. So they're falling back. OSHA has a fallback standard, and that's the General Duty Clause. The General Duty Clause has been used in the past, often by OSHA. There are really 4 criteria that have to be met to meet on the General Duty Clause or to get a citation under the General Duty Clause. So first, the employer has to fail to protect employees who are exposed to a hazard. Okay. That hazard has to be recognized. It has to be a well-known, recognized hazard. In the case, obviously, in the case of COVID-19, it's a well-known and recognized hazard. The hazard is likely to cause death or serious physical harm. And of course, we know that in some individuals, COVID-19 causes death or physical harm. And the fourth criteria to issue a citation under the General Duty Clause is that there is a feasible and useful method to correct the hazard. So feasible and useful method. So that's the fallback. Plus, as we'll see again, there are several standards that touch on COVID-19 protections, respiratory protection, blood-borne pathogen standard, signs and notices in the workplace. So there are other existing standards that OSHA could find a problem with when if they were to come and look at your COVID program. The COVID-19 prevention program OSHA finds it is the most effective way to mitigate the spread. They say effective programs engage the workers and their representatives at every step. It's not something that the safety director or the plan manager, writes over the weekend and establishes on Monday. They're saying the most effective programs have input from the entire workforce, and they include 16 elements. So we're going to go through those 16 elements. What the guideline says should be in a workplace COVID plan. 1, put someone in charge of it. Number 1, you need to have a workplace coordinator responsible for the COVID-19 issues on the employer's behalf. Simple enough and makes good sense. Number 2 is hazard assessment. So really the key to this, after you put someone in charge, is that someone has to make sure that hazard assessments are done. Identify where and how workers might be exposed to COVID-19 at work. Again, it's most effective. It involves the workers because they're most familiar with the conditions they face every day. A CNC lathe operator may have a step where they repair tooling or they deliver tooling to the tool shop, or they may have duties that are outside of their routine duties that we want to make sure are evaluated as part of the hazard assessment. Here's just a hazard occupational risk pyramid right out of the COVID standard. And you classify workers as very high risk, medium risk, or lower risk. And again, then you put in, instead of doing general workplace requirements, you put in the most hazard protection for the very high risk workers, and there could be a lesser degree of protection for the low risk workers. So hazard assessments number two. Once you've done the hazard assessment, what are you going to do? Identify measures that will limit the spread of COVID-19. And this is just OSHA's hierarchy of controls from preferred to less preferred. So if you can just plain eliminate the hazard, that's ideal. Doesn't require any action by the employee, anyone following, anyone using special equipment. So ways to eliminate the hazard: physical distancing in all communal work areas, provide remote work where it's possible, telework. Want to make sure you have a plan that anyone who is infected or potentially infected either stay home if they know they're infected or potentially infected before they come to the workplace, or if they start to develop symptoms in the workplace, that they know to separate right away, and where they be isolated and how to be isolated, who to report to. All those controls need to be in place. Then there are engineering controls, ventilation improvements, physical barriers between workers. Finally, administrative policies, or not next to final. Face covering, staggered work shifts, traffic flow patterns, hygiene supplies, routine cleaning and disinfection, having all those things in place. And finally, the least preferred is putting people in personal protective equipment, such as starting a respiratory protection program, or putting more people in your respiratory protection program to protect them from COVID exposure. Roles of employees. The fourth step is for workers that are higher risk. So if you have workers with underlying health conditions that are older, just a reminder that workers with disabilities may be entitled to reasonable accommodations under the Americans with Disabilities Act. But employers should consider reasonable modifications for workers identified as high risk, including some or all workers, including work at home, moving the high-risk workers to less occupied spaces or spaces with better ventilation. So things you can do for workers that are identified as high risk. Big step number 5, communication. So you have to have a system for communicating with the workers. OSHA just reminds everyone that it has to be in a language that they understand, or a manner accessible to individuals with disabilities. Don't want to forget about any of your workforce. So you have to have a reporting system for the workers to report symptoms or exposures, and any possible hazards at the workplace that they see without fear of reprisal. You need to be sure you're communicating all policies and procedures implemented responding to sick and exposed workers. And the additional elements, there's guidance after the 16 steps. We're going to go through the guidance quickly, and there are additional steps for educating and training workers and making sure everyone's aware of your newly established COVID-19 procedures. Best practice is to create and test a two-way communication system before you need it, that the workers can use to self-report if they're sick or been exposed, or to notify you of any exposures they've experienced. Okay, that's number 6 of 16. Train workers on COVID policies, procedures, use accessible formats and language. Obviously, communicate policies clearly in whatever major languages that may be spoken in your workplace, and make them available to workers with disabilities. But what you want to do is communicate your methods And make sure that you communicate to your contractors and other individuals who may be on the website. You want to communicate basic facts about COVID-19, your workplace policies and procedures, and then you need a way, as with all tests, with all training, to track who's been trained, so you keep a record. Again, OSHA reminds us to ensure the workers understand their rights to a safe and healthful workplace, whom to contact with questions and concerns, and the right to raise concerns without retaliation. Make sure your supervisors are also well aware with your procedures, the anti-retaliation, workplace flexibility, and any other human resource policies that might apply. Number 7, just instruct workers who are infected or potentially infected, who've been exposed, to stay home and isolate or quarantine. So you want to make sure that workers not punished in any way, loss of pay for staying home and keeping the rest of the workforce safe. You should be carefully review your policies, incentives, whatever you have in place with your human resources department, to make sure that your policies don't encourage workers to come to work sick or exposed. There's no incentive for not isolating if you've been exposed. Okay. 8, minimize the negative impact of quarantine and isolation on workers in any way you can. Allow telework or work in an area isolated from others if possible. Allow workers to use paid sick leave if available. Consider implementing paid leave policies to reduce risks of workers coming in because they need their paycheck. And just a reminder that the Family First Corona Response Act provided certain employers with 100% reimbursement through tax credits for employees with paid sick leave through March 31st. I don't think that's been renewed. I'll check on that and report later. I was going to and I forgot. Okay, number 9, isolate workers who show symptoms at work. So you need to have an isolation room, an isolation spot. You need to know what to do if a worker comes to you and says, I'm feeling ill and I'm a little bit concerned they may be coming down with COVID. You need a way to get them separated from your other workers, from your customers, any visitors, until you can get them sent home or sent to seek medical attention. Okay. Number 10 is to perform enhanced cleaning and disinfection if someone in the facility is suspected or confirmed. So once the area is disinfected, it can be reopened for use. It's not like that area is out of operation forever. So workers without close contact with a potentially infected person can return to the clean and disinfected area immediately. If it happens to have been more than 7 days since the infected person visited the facility, before you get notification or because of a holiday or whatever, the virus doesn't remain viable after 7 days. Most usually doesn't remain viable after 24 hours in most cases. And so there's no need for additional cleaning and disinfection in that case. Yeah. Hands cleaning and disinfection. Close the area used by the potentially infected person, close it off, open outside doors and windows so you get some air circulation. Wait as long as practical before cleaning. If it's a possibility to wait, if you give it 24 hours, as I just mentioned, many of the viruses are not, can't survive on a surface beyond 24 hours. So you'll have a huge reduction in the amount of contaminant that might be there just by waiting 24 hours. After waiting as long as you can, clean and disinfect all work areas, equipment used, offices, remember bathrooms, remember shared tools and shared workplace items, work surfaces, any shared electronics, keyboards, that sort of thing that the potentially infected person may have touched. Vacuum if vacuuming is needed. If available, you should use a HEPA vac, a high efficiency particulate air filter vacuum. And you don't want to vacuum until the space is unoccupied, because there's always a case, especially if you aren't using a HEPA, there's always a case of re-entraining some particles through the vacuum exhaust. Provide clean workers with disposable gloves. Additional PPE is required. Basic hazard communication. Look at the safety data sheet, and follow any guidelines on any protection that might be needed from the cleaning supplies. After cleaning, it's important that you clean first, because dirt, particles, grime can occlude the disinfectant from having contact with the virus. So first we clean, then we disinfect. Use an appropriate EPA registered disinfectant. A lot of those you'll see have residence times. Make sure you take that into effect. That's not just wipe on and wipe off. If EPA says you need a 60-second resident time, you have to make sure the surface stays wetted with a disinfectant agent for at least the resident time. And follow it again, just like with the cleaning products. Look at the safety data sheets and make sure you're protecting your workers from any hazards they might be exposed to in using the disinfectant. Providing guidance on screening and testing. This should be in your thought out plan. What are you going to do about screening and testing? So once you've determined what you're doing, inform workers of testing requirements, if any, and availability of testing options. Again, follow the CDC guidance on the frequency of testing, number of days before work that the testing has to be done before returning to work. So note that performing these health checks is not a replacement for other protective measures. Just because you're doing screening doesn't mean that face masks and distancing and barriers come down. It's just another weapon in our arsenal against COVID-19. And that's because asymptomatic individuals or individuals with very mild cases may not realize they're infected and may not be detected in the screening process. Okay. 12, OSHA recording. You have to follow the usual OSHA recording rules. Employers were responsible for recording work-related cases of COVID-19 on the Form 300 logs. I'll just mention here too that in the Virginia standard, during the pandemic, if you get 2 or more cases within 14 days, that's something that's to be reported to the state safety agency, or even outside the pandemic under the new standard. If you get 3 cases of COVID within 14 days, you have to report it to the state. So it's an approach that OSHA may adopt in their standard. If the case is a confirmed case of COVID-19, if the case is work-related, it's really an important thing. If an employee was exposed at a birthday party or family get-together, that's not a work-related case. But if that if an exposed worker came to work and later 3 employees in that person's department come down with COVID, that's a pretty good case. There's guidance at 1904.5, but that's an indication that's work-related. There's even guidance, say 3 workers come down with it, but they're also on a bowling team, and the entire bowling team came down with COVID. Okay, now you have a case that's not work-related, even though they happen to be co-workers. But if the case involves 1 or more of the relevant recording criteria, injury and illness, a removal from work or medical care, it has to be recorded. Okay, 13, back to retaliation. You need to implement the protections from retaliation, set it up in anonymous processes for workers to voice concern. Section 2 of the OSHA Act, or 11 of the OSHA Act, prohibits discharging or discriminating employees for engaging in various occupational safety and health activities to protect their own health. You cannot discriminate against an employee for raising a reasonable concern to you, to your agent, to other employees, to a government agency, or to the public if they feel that's what they have to do. And you can't retaliate to an employee for voluntarily providing and wearing personal protective equipment, such as a respirator, face shield, gloves, or surgical mask, if they feel that they need it, it's more protective for their own health to do that. And we'll talk about that again, that OSHA actually encourages you to encourage workers to use voluntary protection measures if they feel safer doing that. So again, on the anti-retaliation theme, you have to ensure your workers know who to contact There are prohibitions against retaliation for raising concerns, and OSHA recommends using a hotline or other method for workers to voice concerns anonymously. I know a lot of us already have an HR hotline to report sexual discrimination, other forms of discrimination in the workplace. So you may even have a vehicle in place. You then need to make sure that your workers understand that they have a code concerning that vehicle's available to them. Make a COVID-19, make a vaccine or vaccination series available at no cost, and provide information and training on the benefits and safety of vaccinations. OSHA feels strongly that a vaccinated workforce, CDC feels strongly that a vaccinated workforce, a vaccinated population is going to vastly, control where we are with COVID, and they want employers to encourage employees to be vaccinated. Once vaccinated, do not distinguish between workers who are vaccinated and those who are not. Just because you're vaccinated, the rules don't change. And also, you don't want to set up a discriminatory practice against workers who, for whatever reason, elect not to be vaccinated. So vaccinated workers follow the same rules because there's no evidence that vaccines prevent the transmission, totally prevent the transmission. CDC explains that experts need to understand more about the protection vaccines provide before deciding to change these recommendations. So as we all know, we've been dealing with so many unknowns still with the COVID-19 virus. 16, the final step, just be aware there are other applicable OSHA standards, requirements for PPE, the whole respiratory protection requirement. Remember that if a worker voluntarily uses a filtering face piece respirator, a dust mask type respirator, you have an obligation to provide them with the information in Appendix D of 1910-134. So even though it's voluntary, it still triggers some requirements. If you're going to allow an employee to voluntarily wear an elastomeric, a rubber flexible face piece with cartridges, that triggers other requirements. Even though it's voluntary, you as an employer have to make sure that they've had the medical screening to make sure that they don't have any respiratory condition that would prevent them from having to wear that respirator. You also have to provide sanitation, clean storage requirements. So you need to have a written program that tells how you'll address these things. So again, voluntary wearing of a dust mask, provide Appendix D. Voluntary wearing of a full respirator and elastomeric filtering, cartridge filter type respirator, written program, storage, cleaning, medical screening. Again, there's not any specific OSHA standard right now. Standards, OSHA's employers are still required under the general duty clause to provide a safe and healthy workplace. Okay, those are the 16 guidelines, the 16 steps to a written workplace COVID program. Then OSHA has included several notes as a follow-up. Employers who think they had COVID-19 and symptoms can return to work according to CDC at least 10 days since symptoms first appeared, and go at least 24 hours out with no fever without taking any fever-reducing medication. And their other symptoms are improving. They point out that loss of taste and smell may persist in some cases for weeks, and isn't an indication that the affected person is still infectious. So that's not a symptom that needs to delay the end of the isolation. Some workers might need to stay home and isolate longer, really based on what their healthcare provider recommends. So up to the healthcare provider can seek information from national sources of the local health department in determining when a case, especially a case that developed an advanced illness, admission to a hospital, supplied oxygen, may need to stay in isolation longer. So it's up to their healthcare provider to release them. Just some notes for you. Uh, the Americans with Disabilities Act provides a lot of protections to employees with disabilities, but you can, if you elect to, require a doctor's note for those workers to verify their health and able to return to work. That's a policy that you might want to think twice about, just because there are potential delays in the healthcare system, and the requiring the return to work note might also delay their return because they can't get in to see their healthcare provider. Workers recovered from symptoms after testing positive may continue to test positive for 3 months without being contagious to others. So for this reason, you should only retest workers if they develop new symptoms. Testing. You can allow them to come back to work after their symptoms clear up. So there's no reason to continue to test on that occurrence. If they have new symptoms, they should discuss getting tested again with their healthcare provider. The CDC reports that instances of reinfection with COVID have been very infrequent. CDC does not recommend antibody testing to determine which workers can work. Antibody tests just test whether you've had it in the past, and they're not very reliable. The viral tests check a respiratory sample, such as the nose swab, for current infection. So that's the recommended test for return to work. Workers should quarantine if they've been exposed to COVID-19. So the exposure CDC guidelines are within 6 feet of someone for a total of 15 minutes or more within a 24-hour period, starting from 2 days before their illness onset, or 2 days prior to the test specimen being collected, and they provide, or if they provide healthcare at home to someone who's sick with COVID, or they had direct physical contact with someone who's sick with COVID, or they learn they've shared eating and drinking utensils with someone who's infected, or if someone who has COVID sneezed, coughed, or somehow got respiratory droplets on them, in a situation where face masks weren't used on either the employee or the infected person. So those are all indicators where a worker should quarantine until they get their 14 days in and they know they haven't been infected. CDC guides provides for individuals who've been exposed should stay at home 14 days after last contact, watch for fever, other symptoms, stay away from others until they know that they're not affected, they're not infected. Local health departments sometimes make other recommendations. They weigh returning to work with the risk because the risk goes down. So there are health departments that recommend ending quarantine after 10 days without testing, or after 7 days after receiving a negative test. CDC endorses quarantine for 14 days, but recognizes that local health authorities have the authority to come up with other strategies. But if for example, you're allowed to return to work in 10 days, should be real careful about watching for symptoms for another 4 days, because you're not totally out of the risk window at that point, and immediately self-isolate if you notice any symptoms, and that you follow all the requirements. Wear face covering, social distance, wash hands, avoid crowds, but be extra careful if you're still in that 14-day window. And OSHA does recognize that if you're a critical infrastructure provider and you have a worker who's critical to continue to provide your service, that you can put safeguards in place, but allow a worker like that to work with appropriate safeguards in place. So they recognize there may be a case where someone who's critical to public health and safety and is maybe asymptomatic continues to work while infected. Additional detail on key measures: implementing physical distancing in all communal work areas by limiting the number of people in one place at any given time, flexible work sites, telework where possible, flexible work hours, rotate or stagger shifts. If you're a one-shift operation, they consider going to 2 or 3 shifts, or at least voluntarily allowing workers to work on other shifts. deliver services remotely wherever you can, phone, video, web, implement flexible meeting and travel options, and just increase physical space between workers at the work site. You know, you can rearrange workstations, the things that may be possible to do in the workplace that increases separation between workers. Also, make sure you have steps in place if you're, if you're provide work to a customer interface, that you take steps to make sure you minimize exposure between workers and the customer. Okay. Other ways to implement, I just mentioned altering the workspace to allow physical distancing, move workstations around and move equipment. Methods of physical distancing include signs, tape marks, decals, other visual clues placed 6 feet apart just to indicate where to stand to maintain separation. Shift primary stocking activities to off-peak or after hours, just minimizing interaction with those employees. Offer vulnerable workers options if they're available. Duties that minimize. So they have older workers, workers with respiratory problems that normally work as a cashier. Maybe they can work after hours restocking shelves. If they agree to doing that. So OSHA is asking you to be creative to minimize exposure. Close or limit access to common areas. I know most shops have shut down their lunchroom or provided big separations in their lunchroom and made other accommodations for workers to take their meals, prohibit handshaking or other forms of physical contact. Sure, all businesses and employees sharing the same workspace. So if you work in a situation where there are multiple employers in the same workspace, you want to make sure you're coordinating with the other employers to make sure your employees are protected. When you don't have physical distancing allowable, there is additional industry-specific guidance. I'll give you connections to that at the end of the presentation. We'll see that OSHA is issued industry-specific guidance for a lot of industries. Installing barriers where physical distancing can't be maintained, and they give examples of workstation, avoid face-to-face pathways, good with customer interaction, that's a big one. Openings between barriers where if you have to pass things from worker to worker, individual to individual, openings should be as small as possible. And barriers do not replace the need for physical distancing. You still should, even with addition to the barriers, maintain a 6-foot distancing wherever you can. Suppress the spread of the hazard using face coverings, proven to work. Provide all workers with face coverings unless you're providing them with a respirator. Face coverings should be at least 2 layers, tightly woven, breathable fabric, cotton's recommended, no exhalation valves, fit snugly over the nose, mouth, and chin. Face covering should be provided at no cost. If there are workers who have unable to or have difficulty wearing masks, discuss options. Consider masks with clear mouth coverings for workers with hearing deficits. So if you have an employee who works closely with another employee and relies on lip reading, for example, there are masks with clear mouth coverings to try to facilitate that. I know there's a lot of problems with those things steaming up. So there are limitations to what we can do. Requiring at the workplace to wear a face covering unless they're eating or drinking, or it's a customer underage too. Face covering does not eliminate the need for physical distancing. It's just another measure we're taking. Where face coverings become wet and soiled because of the nature of the work environment, provide replacements daily or more often as needed. Face shields provide some protection, but are not an alternative to face masks. Can be used in addition, can be used to protect your face masks. But some early guidance came out saying that a face shield could be used in lieu of a face mask. They aren't as effective as a face mask in preventing these aerosols from getting into the work atmosphere. where face coverings increase risk of heat-related injury or other safety concerns, consult with your you should consult with the employee, your safety person, consult with the employee and to try to find an accommodation that works. Improving ventilation, a lot of guidance from OSHA on improving ventilation, because the idea is just we want to keep these particulates out of the atmosphere. There's CDC has released guidance about ways of improvement. A lot of it's based on ASHRAE guidance for building operations during the COVID-19 pandemic. So ASHRAE is issued a standard. But you want to first of all, just make sure your ventilation works. Preventive maintenance. Operates properly to provide acceptable air quality. When it's possible, increase your ventilation, increase your fan rates. If conditions allow, increase fresh air by opening windows and doors. OSHA points out not to create a safety hazard by opening a door or safety where there's a fall risk or triggering asthmatic condition, something like that for specific employees. Use fans to increase the effectiveness of open windows. Avoid placing fans when they're blowing, the air from one employee, right into the face of another employee, from one breathing zone to another. One strategy is to place fans securely in the window, exhausting room air, because that's going to draw fresh air in, create a negative pressure, and draw fresh air in from other openings. If you have demand-controlled ventilation for energy efficiency, disable that and just let the ventilation run. Same thing if you have recirculation systems for comfort, heating, or for especially for energy conservation, to the extent that you can reduce the recirculation and still get effective ventilation, you should do that. Okay. Also improving ventilation, improve the air filtration on your system to MERV 13 or higher, to make sure you're capturing those particulates, or the highest compatible with the filter stack. Sometimes, a MERV 13 filter might not fit in your existing filter holder, but something more efficient than what you're currently using will. And they ask that you improve your filtration to the extent practical with your system. Also making sure, because can be a lot of bypass on loose fitting filters in the system. You seal the edges, so the air has to pass through the filter on its way through your system. Make sure that you're maintaining your filters are within the service life, installed right, and they're changed out, based on the manufacturer's recommendations. You're frequently changing your filters out. Keep systems running longer, 24/7 if possible, to enhance air exchanges. Even when the employees aren't there, you're still, cleaning any particulates that might be lingering in the indoor air. Ensure restroom exhaust fans are functional, operating at full capacity. Inspect and maintain all local exhaust ventilation in areas such as kitchen and cooking areas. Use portable high efficiency fan filtration systems to enhance air cleaning, especially in higher risk areas. And they give us an example of nurse's office. Generate clean to less clean air movement. So you may want to rethink your ventilation system in light of COVID-19. So things that might have made sense for general air conditioning and comfort HVAC might not make so much sense, especially in a healthcare setting where you have infected patients. I want to make sure that your air movement strategy it considers a possibility of contamination with COVID. And finally, you can consider using ultraviolet germicidal irradiation to help inactivate the virus. There are upper room UVGI systems that shine UV light over the occupants' heads to provide air cleaning. Or if you have an induct system, you can provide UV light in your duct system to disinfect air that passes through. If your ventilation can't be increased, you can also look at reducing your occupancy level. So the effective ventilation Effective dilution is improved if there are fewer employees in the workspace. Yep. And finally, as I said, bottom of the hierarchy of controls, if all else fails, then it's time to consider PPE. So provide all necessary PPE to workers at no cost. If you're recommending respirators, N95 or higher, N99, building face-based respirators. And they recommend without exhalation valves or vents. There are now on the market sort of COVID-19 respirators that don't have the exhaust valves. Your exhaust air actually runs through the same filters as your inhaled air. So you're both inhaling and exhausting filtered air. Face shields as needed, protective gowns, gloves, all based on your hazard assessment. Provide PPE in accordance with all the OSHA standards. Of course, the OSHA standards don't go out the window. And in fact, as part of this national emphasis program, OSHA is going to be looking specifically at whether you're meeting these standards if you're providing personal protective equipment. So there's additional information on PPE flexibilities and prioritization section within the minimum guidance. So it's a good reference piece. Again, it's one of the references, one of the only 4 references, 4 or 5 I have at the end of the presentation. And there are times when PPE is not required, but either it's a reasonable accommodation due to a disability, or other ones are still, or employees are still concerned and want to wear PPE. And again, OSHA's stance is that you should encourage and support voluntary use of PPE if a worker feels safer wearing the PPE. Okay, respirators must be provided and used in compliance with 134 written program medical determination that the worker is able to wear the respirator without respiratory problems. You have to be fit and tested. You have to train the workers. You have to provide sanitation and clean storage, and also that even if workers voluntarily want to work these, if you want to allow workers to voluntarily use a respirator, again, you have to do medical determination. You have to have a written program. You don't have to fit test because you haven't determined that they need to wear the respirator for their own protection. But you need to make sure they're trained on disinfect, because you don't want to make the respirator the problem itself. Make sure they're trained on clean storage and disinfection of the respirator between uses. There's some additional guidance available. COVID-19, make sure you provide supplies. Workers, customers, and visitors have the supplies they need to keep the workplace clean and keep themselves clean. So you want tissues and no-touch trash cans. You want soap and water available, warm and tepid water. If you have an isolated area where there's no soap and water, use alcohol-based hand sanitizer that's at least 60% ethanol or 70% isopropanol. And OSHA reminds us to follow safe handling and storage requirements for flammable sanitizers. Use touchless hand sanitizer stations in multiple locations. Just do what you can to facilitate your employees keeping themselves and others safe. So provide time to wash hands often. And for workers, if their hands are visibly dirty, don't use the sanitizer. Use warm soap and water. Key times for workers to clean their hands before and after shifts. So, when you're thinking about schedules and providing time, and also workplace signage and encouraging workers and training the workers before and after shifts, before and after breaks, after blowing, coughing, sneezing, after using the restroom, before and after eating or preparing food, after putting on, touching, or removing PPE or face covering, after coming into contact with surfaces other people are touching. And the place posters that encourage hand hygiene and physical distancing. Make sure that you're communicating with your non-English speakers, and you're communicating with all employees. Routine cleaning and disinfection. You should have a plan. We're going to clean daily. We're going to clean these surfaces. We're going to clean these areas. We're going to use this cleaner. Routinely clean all frequently touched surfaces. For dirty surfaces, soap and water first, For disinfection, use EPA registered disinfectants. Follow the manufacturer's instructions on concentration, application method, and contact time. Make sure that if that particular disinfectant says it needs 10 minutes contact time, you're allowed 10 minutes contact time. Or find something with a shorter contact time if that's not working for you. Clean and disinfect shared tools. Provide disinfecting wipes. Store and use disinfectants according to the label, obviously. Wear gloves and other PPE according to the safety data sheet is appropriate for the chemicals being used. And just a reminder, do not mix bleach or other cleaning products together. Bleach and alcohol makes a fatal mix. And still, you read cases. I know of a case not too long ago where an employer mixed cleaning products and ultimately died as a result of the inhalation of the chlorine gas. So that's it for the guidance. OSHA has issued specific guidance for several different industries. They're all available at this link at the bottom of the screen. So if you're in agriculture, airline operations, anybody on this list, hair and nail salons, waste management, there's some specific guidance for safeguards that can be used in your industry. Okay. References, this national emphasis program can be found at this link. The OSHA memorandum for updated enforcement. Well, I want to mention that an interesting thing here too. OSHA, in addition to making sure you're protecting your employees, they have an obligation to protect their employees. So in this interim enforcement response plan, there's some interesting guidance because they ask the compliance, safety, and health officers to minimize in-person meetings with employers as they can. So they're encouraging employers to provide data and documents electronically rather than handing over paper during the inspection. And the response plan indicates, as you may know, there's a prohibition of OSHA giving you any notice that they're going to be there. And the response plan indicates that area directors can lift the normal prohibition from contacting employees ahead of an on-site inspection so that they can coordinate the compliance, safety, and health officers on-site and visit to ensure that the compliance, safety, and health officers getting the maximum protection from COVID-19. What your requirements are, what measures you're taking before they even decide to send the operator in. So in addition to a lot of guidance for you as an employer, OSHA has issued guidance to itself to ensure it's protecting its employees. So any questions, any follow-up, contact us. We have a Facebook page. We have a Twitter account. There's our web page. There's our 800 number if you'd like to get in contact with PA consultation program. You can also contact me directly at Rick Mason. It's rmason@iup.edu. There's my direct phone number, which is 814-795-8960. And if you're interested in having a PA OSHA consultation visit, you go to our website. There's a link right there. You see that burgundy link, the free consultation request form. So you can either call the 800 number, submit that form online. On our homepage, you see this part 1 getting started. There's a short video that just talks about the program and getting involved in the free Pennsylvania OSHA consultation program. A plug for Pennsylvania Bureau of Workers' Comp, Pennsylvania Bureau of Workers' Comp, that they have a lot of really nice training materials, and also will provide some live training either on site for large groups or via webinar, and their contact information is here. If you need a PowerPoint on any topic, any safety topic, they probably have it. They've got dozens on their website. So thank you. Our next webinar is next month. It's on the impact of mental health and safety. And that's it. I appreciate your attention and hope that this has been informative, and just want to say goodbye, and I'll end the recording. Thanks for your attention.